using intraoral cameras for quite some time, but we've been using the mouthwatch cameras specifically for a few years now.
I learned from a very, very smart dentist who was younger than me that the smartest thing you can do is at the beginning of the appointment, take a few pictures and put them on the screen and just leave them there. And then as the patient draws their own conclusions over what that picture means and what you're trying to share with them, by the end of the appointment, you have already educated them that they want to know what is happening there.
We're located here in Bridgeport, Connecticut. We are part of the University of Bridgeport. Since the beginning, focus has been public health, figuring out how we can get into the community, work with the community, speak with the community, and meet the needs, the dental health needs and overall health needs of the community.
Intraoral cameras are fabulous anyway. As far as patient education is concerned, we're able to educate the patients more. We're able to show them exactly what we see in the mouth. I've always been a big fan of intraoral cameras, but now, again, with the technology that's involved with mouthwatch cameras, it's much easier. They're lightweight, they're easy to position them in the patient's mouth, they're easy to utilize. So the students have been able to capture more images and keep records better so that this way Dr. Boyce can properly diagnose these patients.
The student presents the patient to me exactly the same as they would in our clinic in person. They go through that same rundown, and as you know, students in dental hygiene school, they're very thorough, and patients see that, and they see that it's a conversation. They see that the student and myself are really collaborating on their care along with the faculty that is at that rotation, Amanda Sargent, and it's accepting. They're happy. They're glad to know what's going on. They're glad that it's in their community and that the financial barrier and geographic barrier is removed from their care.
That in and of itself is great. It offers the best that we can for the moment to patients in terms of access to a dentist. They have us, but you do need that official diagnosis, and it enables us to do that.
The most successful part of this program that I am proud of is how many of these patients now are at the point where they're coming back. It's great to have a one-time patient and to be the one to say, look at this, but when they understand the value and then we see them again in 6 months, when this is someone who previously could not afford or could not get to routine care, that's the win. To see what our faculty have been able to share firsthand with our students and how Amanda, on a weekly basis, cares so much about these patients and knows that they would have no chance of any care if it weren't for this, and if it weren't for the convenience and the proximity as to where we are when we provide this care. I don't think we ever thought that we would more than double the number of patients that we promised to provide for this grant, and it gets you a little choked up thinking about it.